Australia's Pharmaceutical Benefits Scheme, PBS, is set to slash prescription drug costs further, offering hope for millions. The maximum cost of medications on the PBS will drop to $25, bringing prices back to 2004 levels, a move that could revolutionize access to affordable healthcare. This decision follows years of efforts to reduce out-of-pocket expenses, with the federal government lowering the general copayment by $6.60. Pushing the cap from $31.60 to $25 starting January 1st. Health Minister Mark Butler hailed this as a huge difference, emphasizing its benefits for both patients and the nation's budget. But here's where it gets controversial. While the reduction targets the most expensive medications, critics argue it may overlook essential drugs that remain costly for many. Australians are now expected to pay no more than $25 for prescription drugs listed on the scheme, a stark contrast to the $42.50 copayment rate seen in 2023. Labor had already reduced the cap to $7.70 for pensioners and concession card holders in 2023, but this latest adjustment could offer even greater relief. However, the PBS has long been a cornerstone of Australia's health policy, defended by political leaders as a lifeline for low-income families. Yet it faces mounting pressure from the U.S. under President Donald Trump, who has threatened to impose 200% tariffs on pharmaceutical imports. Citing concerns over Australia's subsidy program, the U.S. administration's plan, which remains shrouded in ambiguity, could be seen as a strategic move to weaken the PBS in exchange for trade deals. But both major parties insist they will not compromise their commitment to the scheme. Minister Butler reiterated the government's stance. We will not negotiate on these elements. Yet the question lingers. Will the U.S.'s approach to the PBS truly protect its citizens, or will it simply shift the burden elsewhere? This is where the debate gets heated. Will Australia stand firm, or will the U.S. exploit the situation to undermine its own healthcare system?